Well, there's all kinds of pain,
Yes.
Um, the emotional can lead to physical, the physical can lead to emotional, and both of them can coexist. So,
Yes, absolutely.
yeah.
Absolutely. And I think just like that's the good function of pain.
Mhm.
It stimulates something, someone to heal, to grow.
Yeah, but which ones want to rise to the occasion and which ones are going to be smothered by it? That's the question.
It is. That's a great question. Yeah,
Yeah.
that is the question.
Interventions only can go so far, and in my opinion, they're used as bridges in the rare circumstance that they're needed. But I sometimes feel like we do things with people interventionally or even surgically, not just like injections, but sometimes our attributions to what is really helping the patient. It
So beautifully said. Yes. Yes, you're right.
it might be more than we think it's us, the thing we did to them, but it may have been the fact that A, you spent time with them, B, you let them tell their story, C, you had a very warm and caring environment, D, time and letting time go by, or just the mere nature of not fearing the pain anymore because someone spent the time to address it. And, whether it's placebo or just any of those things combined, I think it's short sighted to say that it's just unless you have really really strong evidence, which very little in pain has strong evidence. Um, I think it's you have to watch what you say. But we've been selling it to the public that these things fix things, and they might help in the context of the setting that you have it done in. But someone who's mean to you and stabs you with a syringe and you feel like they don't care, I would say that's not very therapeutic.
I think there's two parts of us that have to, and I would say maybe even four or five different parts of us that have to travel all together for a person to be whole at any particular point in time. Otherwise, you find at a certain point in time, you find a person's intellect, but you don't find their soul at the same time at the same level. So you're talking to them, and you're not talking to them as a whole person. You're really talking to them as a fragment of their self, whether that be just being overwhelmed with emotions or just an intellectual part. And it starts early, and I think it gets more and more ingrained as time goes by. And we were talking about it, how as physicians, we go through we go through a very similar process. And if you look at a doctor's visit, for example, the physician who is not wholly there, the they don't heal well other people, because they're there in the intellect, but if they cannot feel the pain, and it's not because they've been groomed to be in a certain way so that they can perform at that level. So even if they can do the emotional kind of stuff, if they can resonate with another person, but they don't have the spiritual grounding at that time to ground them to a particular situation, that's another time that you find fragmented parts of a person's ego and a self, just trying to solve something that a whole person can only solve.